Neet PG Grand Test, Set 6 Questions 126 to 150. Question 126. A 40-year-old male presents with difficulty in swallowing both solids and liquids, regurgitation, and weight loss. Manometry shows absence of peristalsis and incomplete lower esophageal sphincter relaxation. Most likely diagnosis: A. Achalasia cardia. B. Diffuse esophageal spasm. C. Scleroderma esophagus. D. Esophageal stricture. Answer: A. Achalasia cardia. Explanation: Achalasia cardia results from loss of inhibitory ganglion cells in the myenteric plexus, leading to failure of less relaxation and aperistalsis. Question 127. The most common cause of community-acquired pneumonia in adults is: A. Mycoplasma pneumoniae. B. Streptococcus pneumoniae. C. Haemophilus influenza. D. Legionella pneumophila. Answer: B. Streptococcus pneumoniae. Explanation: Streptococcus pneumoniae is the leading cause of community-acquired pneumonia, presenting with sudden fever, productive cough, and lobar consolidation. Question 128. In mitral stenosis, the most specific clinical sign is: A. Loud ASAC. B. Opening snap after AS-DUI. C. Mid-diastolic murmur. D. Loud P-DUI. Answer: B. Opening snap after AS-DUI. Explanation: An opening snap following the second heart sound is highly specific for mitral stenosis and results from forceful opening of stenotic mitral valve leaflets. Question 129. Which of the following is a reversible cause of dementia? A. Alzheimer's disease. B. Multi-infarct dementia. C. Vitamin B barrow deficiency. D. Pick's disease. Answer: C. Vitamin B barrow deficiency. Explanation: B barrow deficiency can cause cognitive impairment that is reversible if identified and treated early. Question 130. The gold standard test for diagnosis of Hirschsprung's disease is: A. Abdominal X-ray. B. Contrast enema. C. Anorectal manometry. D. Rectal biopsy. Answer: D. Rectal biopsy. Explanation: Rectal biopsy showing absence of ganglion cells confirms Hirschsprung's disease. Other tests are supportive but not definitive. Question 131. A patient on prolonged heparin therapy develops thrombocytopenia and thrombosis. This is most likely: A. Vitamin K deficiency. B. Heparin-induced thrombocytopenia type 2. C. Immune thrombocytopenic purpura. D. Thrombotic thrombocytopenic purpura. Answer: B. Heparin-induced thrombocytopenia type 2. Explanation: HIT type 2 is an immune-mediated reaction causing platelet activation and paradoxical thrombosis despite thrombocytopenia. Question 132. Which nerve is most commonly injured in fracture of the surgical neck of humerus? A. Radial nerve. B. Axillary nerve. C. Ulnar nerve. D. Musculocutaneous nerve. Answer: B. Axillary nerve. Explanation: Axillary nerve passes around the surgical neck of humerus and is prone to injury, leading to deltoid paralysis and loss of sensation over the lateral shoulder. Question 133. A patient with severe asthma exacerbation is not improving with nebulized beta agonists and steroids. Next step: A. Add intravenous magnesium sulfate. B. Give oral theophylline. C. Start antibiotics. D. Give subcutaneous epinephrine immediately. Answer: A. Add intravenous magnesium sulfate. Explanation: Magnesium sulfate acts as a smooth muscle relaxant in bronchial walls and is used in severe, refractory asthma attacks. Question 134. Most common cause of hypothyroidism worldwide is: A. Hashimoto's thyroiditis. B. Iodine deficiency. C. Post-thyroidectomy state. D. Subacute thyroiditis. Answer: B. Iodine deficiency. Explanation. Iodine deficiency remains the most common cause globally. In iodine-sufficient regions, autoimmune thyroiditis predominates. Question 135. A child presents with recurrent respiratory infections, situs inversus, and infertility. Which structure is defective? A. Microtubules in sperm tail. B. Dynein arms in cilia. C. Actin filaments in cilia. D. Necks and links in cilia. Answer. B. Dynein arms in cilia. Explanation. Dynein arm defects cause immotile ciliar syndrome cartilaginous leading to poor mucociliary clearance, infertility, and situs inversus. Question 136. Which of the following is a risk factor for hepatocellular carcinoma? A. Hepatitis B infection. B. Hepatitis C infection. C. Cirrhosis of any cause. D. All of the above. Answer. D. All of the above. Explanation. Chronic viral hepatitis and cirrhosis from any cause increase the risk of hepatocellular carcinoma. Question 137. A patient with chronic kidney disease develops bone pain and fractures. Labs show low calcium, high phosphate, and elevated PTH. Most likely diagnosis? A. Osteoporosis. B. Secondary hyperparathyroidism. C. Primary hyperparathyroidism. D. Osteomalacia. Answer. B. Secondary hyperparathyroidism. Explanation. CKD causes phosphate retention and decreased vitamin D activation, leading to hypocalcemia and compensatory PTH rise. Question 138. Which vitamin deficiency causes megaloblastic anemia and subacute combined degeneration of the spinal cord? A. Folate. B. Vitamin B baro. C. Vitamin B6. D. Vitamin E. Answer. B. Vitamin B baro. Explanation. B baro deficiency impairs DNA synthesis, megaloblastic anemia, and myelin formation, neurological deficits. Question 139. Based initial investigation for suspected pulmonary tuberculosis? A. Sputum culture. B. Chest X-ray. C. Sputum AFB smear. D. Tuberculin skin test. Answer. C. Sputum AFB smear. Explanation. Sputum smear microscopy for acid-fast bacilli is the initial diagnostic test for pulmonary TB due to its rapid results. Question 140. Which tumor marker is most associated with hepatocellular carcinoma? A. Alpha-fetoprotein. B. SAR. C. CA19-9. D. CA125. Answer. A. Alpha-fetoprotein. Explanation. AFP is elevated in hepatocellular carcinoma and some germ cell tumors. Question 141. Which drug is used to treat both hypertension and benign prostatic hyperplasia? A. Prazosin. B. Propanolol. C. Amlodipine. D. Losartan. Answer. A. Prazosin. Explanation. Prazosin, an alpha-AG blocker, reduces vascular resistance and relaxes smooth muscle in the prostate. Question 142. Which immunoglobulin is secreted in highest quantity in mucosal secretions? A. IgG. B. IgA. C. IgM. D. IgE. Answer. B. IgA. Explanation. Secretory IgA protects mucosal surfaces by preventing pathogen adherence. Question 143. The most common cause of hyperthyroidism worldwide is A. Toxic multinodular goiter. B. Graves' disease. C. Toxic adenoma. D. Subacute thyroiditis. Answer. B. Graves' disease. Explanation. Graves' disease is an autoimmune disorder causing diffuse thyroid hyperactivity due to TSH receptor antibodies. Question 144. Which heart sound is heard in atrial septal defect? A. Fixed splitting of ACE-DUI. B. Wide variable splitting of ACE-DOI. C. Paradoxical splitting of ACE-DOI. D. Loud ASAC. Answer. A. Fixed splitting of ACE-DOI. Explanation. ASD causes constant delay of pulmonic valve closure regardless of respiration, producing fixed splitting of ACE-DOI. Question 145. Best method for confirming diagnosis of insulinoma? A. Fasting blood glucose. B. C-peptide level. C. 72-hour fasting test with insulin levels. D. Oral glucose tolerance test. Answer. C. 72-hour fasting test with insulin levels. Explanation. Supervised prolonged fasting with simultaneous glucose and insulin measurement confirms inappropriate insulin secretion. Question 146. Which electrolyte abnormality is characteristic of Addison's disease? A. Hypernatremia. B. Hyperkalemia. C. Hyperkalemia. D. Hypercalcemia. Answer. C. Hyperkalemia. Explanation. Aldosterone deficiency in Addison's disease leads to potassium retention and sodium loss. Question 147. Most common cause of chronic pancreatitis in adults is A. Gallstones. B. Alcohol abuse. C. Hyperparathyroidism. D. Autoimmune pancreatitis. Answer. B. Alcohol abuse. Explanation. Chronic alcohol use causes recurrent inflammation and fibrosis of the pancreas. Question 148. A patient has pain in the right upper quadrant after fatty meals, fever, and jaundice. The most likely diagnosis is A. Acute hepatitis. B. Acute cholecystitis. C. Cholelocholitiasis with cholangitis. D. Peptic ulcer disease. Answer. C. Cholelocholitiasis with cholangitis. Explanation. Charcot's triad of jaundice, fever, and acute pain suggests cholangitis due to common bile duct stone. Question 149. In rheumatic heart disease, which valve is most commonly affected? A. Aortic valve. B. Pulmonary valve. C. Mitral valve. D. Tricuspid valve. Answer. C. Mitral valve. Explanation. Mitral valve involvement is most common, often leading to mitral stenosis. Question 150. A patient develops flushing, diarrhea, and wheezing. Which tumor marker is most useful? A. Chromogranin A. B. CA-19-9. C. SA. D. PSA. Answer. A. Chromogranin A. Explanation. Carcinoid tumors release serotonin, and chromogranin A is a useful marker for diagnosis and monitoring.